Hi everyone. So today I want to talk about a topic that plagues millions of people around the world, especially young girls, middle-aged girls, and married women as well. PCOS, Polycystic Ovary Syndrome. Now again, when most of us hear of this or people are diagnosed with this condition or this syndrome, they believe that they need to be on particular medications for sometimes a lifetime, or they got to constantly pop all those pills. But we're here today to tell you that it is a lifestyle caused syndrome, and if we change our lifestyle, we can help, heal this condition. With me today, I have Dr. Untitled. This amazing doctor has worked with me on cases ranging from migraines to headaches to cancer to PCOS with clients worldwide. And I've specifically come down to Pune all the way to meet him at his amazing Prana Center of Homeopathy, Yoga and Holistic Medicine to talk about and inspire each of you that PCOS can be healed. We don't have to be on medication for a lifetime. I'm not here and he's not here to tell you that we just give up our medication. We're here to tell you that if you are on medication, that's fine right now, but you need to work parallelly to try and get off the medication by changing your lifestyle, because it is possible. Metformin, oral contraceptives are not things that you can be on for a long period of time. It's okay initially, but that should be your wake-up call to start making changes in your lifestyle, because it's mainly poor lifestyle that brings on PCOS. So now over to Dr. Abhay Talwalkar to take you through his experience of handling PCOS and how he does it naturally using homeopathy and using lifestyle. Over to you.
Hi, hello, and good afternoon to everyone. Good afternoon, Luke. And as you have rightly said, it is an issue which is related to your lifestyle. So we are seeing a lot of young women coming. In fact, women in the age group, fertility age group, at least 1 out of 10 women will come and have PCOS and subsequently fertility issues. So that's how grave the situation is. And mostly it is because of the faulty lifestyle and the stress and strain that the modern woman is going through. Now, gone are the days when she would just cook at home and just sit and look after the children or look after the family. Now she has to rub her shoulders with men, work for the family and earn bread for the family also. So all this is putting on additional stress on her mind, on her emotions, and a lot of these issues are at the root cause of what subsequently develops as polycystic ovarian syndrome. What actually happens is, in a female, when in the normal menstrual cycle, there are follicles created by the ovary, and each follicle matures at a certain level. One of these follicles will mature to secrete an ovum, which subsequently is carried to the fallopian tube, and if fertilized, it results in pregnancy. And the rest of the follicles are degenerated. Now, in cases with PCOS, what happens is that these remaining follicles also remain dominant, and hence they cause our hormonal systems to go haywire, and we have hormonal disturbances, and then subsequently these women will start having symptoms like excessive hair growth or abnormal hair growth, irregular periods, and so on and so forth, and subsequently obesity. And they will come to a stage where nothing will help and they will land up having infertility. Now, conventionally what happens is, as you rightly said, they are put on a lot of metformin and other medications which are having their own side effects, which lead to subsequent insulin resistance, and these women will end up having diabetes also. So this is one of the cause for diabetes also subsequently. So instead of doing that, if we keep them on homeopathic medicine, now homeopathic medicine addresses the issue at the root cause. It will take care of all the mental, the emotional, the physical things that the woman is experiencing, and not only the symptoms of PCOS, because if you take a woman having PCOS, if you take 10 of them, the symptoms will be common. They will have irregular periods, they will have abnormal hair growth, etc. But the cause behind all this, what is the real reason why she landed up into this kind of a situation? In homeopathy, we look into that cause, we try to address it, and the medicines that are used in homeopathy are prepared from natural substances. So they have very less side effects. The power in which we give these medicines is very, very minute, and it is in super dilution form. So again, the chances of side effects, the chances of toxic effects are less, and these medicines actually will work at the energy level. So they will bring about a balance in the energy of the person, thereby subsequently causing or leading to hormonal balance. Okay, but having said this, I have experienced that only medicine, for that matter, will not help. We have to have a combination of proper medicine which is based on the holistic principles. Then we need to take care about their nutrition and exercise. Now about nutrition and exercise, I think you will be better. It will be better that you talk to our
Right, and I think it's like, I mean, like the doctor rightly said, like Dr. Abhay rightly said, it's holistic. I mean, yeah, there are medicines that will treat you at a symptomatic level, but that's what we don't want. We want something that can treat the root cause. See, you get a medicine, it controls your symptoms, and you continue with that lifestyle which you don't change, which is the root cause of your problem. But you need to go down layers and look at what's causing it. If it's stress, let's get down and see if we can manage that stress. Because metformin isn't going to manage your stress for you, it's only going to manage your condition with side effects. And what's surprisingly shocking is a lot of women today like to be on metformin because it helps them lose weight.
Yes.
So, the reason you put on weight during PCOS is exactly what doctor said, and y'all all know by now that weight loss is not only about food and exercise, it's about a hormonal imbalance. It's about an imbalance of energy in your cells. So when you correct all of these at a root cause level, you have a platform of healing. And there's no medicine that you have to be on for a lifetime when you aim and your vision is to heal the human body. So I think it's fantastic what you said. I mean, a lot of my clients use homeopathy today. If people come for PCOS, I know that nutrition alone may not help because nutrition isn't going to take away your stress levels. So sometimes if people want to get off metformins or their oral contraceptives, which I highly recommend that people try to do, of course with your doctor's permission and in a very, very structured way by supporting yourself with the right diet, the right amount of exercise, the right amount of, de-stressing exercises, and of course, homeopathy is something that works parallel with almost any sickness or any disease today. So, doctor, do you have any more points or tips that you would like to leave our viewers with?
The tip that I would like to leave for the viewers is that, often I see that women come at a very late stage to us for homeopathic treatment and by the time they come, their ovarian reserve is almost over. They come to us at an age after 35 or 36 when it is really gets very difficult for us also to help. So I think that they should really think of homeopathy as the first choice or the first option, because the medicines that I am stressing this point again, that the medicines that we use in homeopathy are prepared from natural substances. Hence you will not have side effects and you will go back to your hormonal balance at a very early stage. You may not have to continue for more than a year or so. That's how quickly it can act for you.
Absolutely. So I think that's a great tip, and to add from my observations of patients that we handle with PCOS, one is of course stress, like Dr. Abhay pointed out. It's real, people. I mean, stress impacts every single cell of your body, and each and every one of you are built of over billions of cells. So you have a happy feeling, it impacts all your cells. You're sad, you're depressed, you have chronic stress, it impacts every one of those cells. If those cells have the wrong energy, it has the wrong balance. In imbalance, hormonal imbalance. It's as simple as that. So I see lack of activity amongst young girls today, and they're sitting in front of the TV or they don't go out to play. We need to encourage our children to move. The more activity they have, the more balance of energy they have in their cells. So junk food is a big problem. I mean, you have the wrong fats, trans fats, hydrogenated oils, excess of sugar, excess of salt, all that leads to these imbalances and PCOS. So if you ask me, what I've seen just by reversing their lifestyle, getting them onto balanced nutrition, adequate amount of exercise, making sure they sleep, because today half the girls take their iPads to sleep and they may be in bed by 10 o'clock but they're sleeping by 12 because they're busy YouTubing and all, which is fine, but don't compromise on your sleep. And of course stress brought by peer pressure. I did a video yesterday talking about responsibility of parents and how we need to create a stress-free environment by, I know competition is good, but it's stressing out our children. So if we want them to grow up in a healthy way, there's got to be balance in every impact, and all these little things impact, all these decisions we make impact them. So your daughter or your child or you don't have to live with PCOS. It's in your hands, it's your decision right now to use natural methods which are natural to the human body, which are holistic, to start healing.
Exactly. I think women need to take responsibility of themselves and just get up and start the workout and
Absolutely.
go for more natural things,
Absolutely.
That's what will definitely help. Only the pill is not going to help.
Yeah. If not, there is a pill for everything. We
Yes.
know that, but it comes with all its side effects, and it's going to be worse if you have a hormonal imbalance at 13 or 14. Just think what it's going to be when you're 25, 28, or when you're entering menopause. It's your whole structure of hormones that get imbalanced. So thank you so much, Doctor. Thank you everyone for tuning in, and we look forward to doing so many more videos, because we have doctors, we have nutritionists, everyone who believes today that healing is holistic in nature. Doctors are great, medicines are great. We need all of that. But in the center of this whole circle is the patient, is the person with the illness. And we want to use everything that's possible around, which is in the best interests of the patient, to heal. There's no one who's right, there's no one who's wrong. Everyone has their own talent and their expertise. And if we can learn to work together, to combine the talent of homeopathy, of oncologists, of allopathy, of every single medical entity out there, I think it's the patient that benefits at the end of the day. We have to look at prevention more than cure. All the wisdom is in preventive measures. Thank you everyone. Thank you Dr. Abhay, and have a great evening everyone.
Thank you. Bye.